with traumatized people who benefited most from what is now known as the three-phase model of trauma therapy. 1. Establishing safety and stabilization. 2. Coming to terms with traumatic memories. 3. Integration and reconnecting with others, which continues to be recommended by the International Society for Traumatic Stress Studies, ISTSS. But every patient has different needs, so any model of treatment can only provide a general overview. Ultimately, the therapist and the patient must decide together what type of treatment is best for their situation. It's well worth the effort to determine the smallest risk. Many years ago, one of the most experienced therapists in the field of psychotraumatology, Richard Kluft, said, "The slower you go, the faster you'll get there." It's especially important to me that victims develop compassion for themselves, or if they already feel such compassion, that they learn to express it more. Attending to healing inner pictures and ideas has proved fruitful. With this in mind, I continue to recommend, as I did 20 years ago when I first wrote about this, to proceed with caution. Who is this book written for? This book is primarily for therapists. Today, more than ever, good therapy also means informing patients as thoroughly as informing colleagues. Comprehensive information is the best basis for good collaboration. Furthermore, it's important for traumatized people to always be well informed so that they can maintain a sense of control. This book can also be for patients who want to keep themselves informed. The method I describe for using imagination can be useful for everyone. I speak directly to the listener, though therapists may benefit from the many applications of imagination to take care of themselves as well. However, I would ask that therapists not share anything with patients that they themselves haven't tried or don't like. This book only briefly touches on theories of post-traumatic stress disorders, seeing as there's ample literature available on the subject. I recommend The Body Keeps the Score: Brain, Mind, and Body in the Healing of Trauma by Bessel A. van der Kolk. This book was conceived of as a sort of progress report. The practical examples provided are intended to encourage therapists to take a compassionate and resource-oriented approach in their work on the sequelae of trauma. Basic thoughts on trauma and trauma treatment. When I assumed the position as head of a psychosomatic clinic in 1985, German psychotherapists and psychiatrists were paying virtually no attention to their patients' trauma. Psychoanalysts believed that most of what patients said about their trauma did not actually reflect reality. Alice Miller, who published several books on this topic in the 1980s, was hardly taken seriously in professional circles. Rather, trauma reports by patients were dismissed as mere fantasies. Since 2010, however, there has been much discussion about sexualized violence, and many victims have spoken up. Many others fail to speak up because they fear, not without reason, a lack of understanding. In my clinic, patients felt safe enough to talk about the violence they had experienced. We now know with certainty that traumatic experiences can be identified as the cause, or contributing cause, of several emotional and psychosomatic illnesses, particularly borderline personality disorders, but also depression, addiction, eating disorders, self-harming disorders, and somatization and anxiety disorders. Extensive studies have since shown that even cardiovascular diseases and other chronic diseases, such as diabetes, especially type 2 diabetes, can be linked to childhood trauma. Fortunately, it no longer takes as much courage as it once did to accept that patients are relating real experiences. Until the beginning of the 21st century,